Based on my understanding, based on my practice, based on the philosophies at the time, there were a couple of reasons. You would take a textured implant and you would put it above the muscle. And this texture wasn't really hard or rough like sandpaper. It was a finer grit on the top. It would allow your own tissue to kind of grow and attached to the implant surface, almost like Velcro, and it would keep the implant pretty stable. So if you guys have followed me, I've talked about, implant abnormalities, like implants being kind of out of position, out to your armpit, kind of down below. A textured implant above the muscle was touted as a really great idea because it velcro the implant to your breast and, for lack of a better term, to the top of your muscle. And so it kept its shape and position. That was a that was really hot. But come to find out that women were presenting back to, maybe their original plastic surgeon or to another plastic surgeon if they've moved or the plastic surgeon retired or, heaven forbid, passed away, or maybe into their primary care physician because they've got a swollen breast or they felt a lump in their arm, and which caused great alarm. When that was found, these patients got back to their plastic surgeon, and it was found through various test x-rays that these women had a fluid around their breast implant. And that fluid, when that fluid was drawn off with a little syringe, found under a microscope to have these cancerous cells. And these cancerous cells are really from the inflammation, the normal reaction of your body to this textured implant that causes that implant to become kind of sticky. But that inflammation, unlike when you cut your finger,